And I mean, I just don't see sitting and waiting for the inevitable, because it is inevitable to happen. I went in the hospital in emergency thinking my cancer had come back. And in doing an MRI and a CAT scan, they found I had this aneurysm. The cardiologist told me they couldn't take care of him here at Parish, so they were going to send me down to Dr. Imami, who practices at Palm Bay.
I first met Virginia Stoner about probably 2 months ago. She came to me from Titusville with what appeared to be a thoracic aneurysm, an enlarging thoracic aneurysm. So she essentially has a big balloon of her main blood vessel in her chest. This condition becomes serious as the aneurysm continues to expand. Mortality or chance of death increases rapidly as the aneurysm increases. She has quite a few other medical problems which would preclude her from having conventional, you might say, old-fashioned surgery of the chest.
In 1992, when I had the bypass surgery, that's how it was done. The breastbone was cracked open. All that has to heal from the inside and the outside. And it's very painful. I think at my age I could even stand to go through that again.
I talked to her about options of thoracic endograft or minimally invasive aortic surgery. She's the first here in Brevard County. I've been doing these prior to my arrival here in Brevard County, which has been about 3 years. It's essentially placing a stent, a covered stent, inside the aneurysm sac and sealing off the balloon component of the aneurysm. It's done through the groins as if having cardiac stents, except much larger, and usually requires an overnight stay, 2-night stay in the hospital with recovery of no heavy lifting for about 2 weeks, versus, say, conventional surgery where she would be in the ICU for a week to 10 days and probably rehab afterward.
There's the risk that you could have a stroke or a heart attack, you could have some paralysis, you could die, but those are the same risks that you have if you don't have the operation.
My 80th birthday is today. Oh, I have great treatment. I have the best nurses. They're all great. They're so dedicated, and they've got their hands full.
I feel great. It's now 6 weeks later. I'm back to almost normal, doing all the things I like to do. These younger doctors that are keeping up on all the new methods and the new equipment and tools of their trade, it's a blessing.